These are clergymen and women synergizing to finding lasting solutions to the current critical issue of malnutrition in the country, which is currently affecting 37 of the children in Nigeria. It is the World Bank's funded Accelerated Nutrition Result in Nigeria Strategic Dialogue, being hosted by the Kukah Centre in Abuja. The leaders are being empowered to take the lead in spreading the information on the accessibility of basic food and childcare nutritional services in the country.
Despite the conflict in Maiduguri, according to UN, Maiduguri still has one of the highest number of children. So even in violence, we are still giving birth to children. And within this population, about 37% of our children under 5 years of age, are suffering from stunting. I was just mentioning to one of the presenters, in 10-15 years, if something is not done, the whole of my area, we may end up with a generation of dwarfs.
A situation where our children compete at a global standard because they've been fed right, and we understand the economic situation and the issues of food security in the country.
Omolara Olagunju is a consultant family physician and faith influencer. She maintains that if urgent steps are not taken to tackle malnutrition in the country, there will be consequences.
Of course, the immediate effect of poor nutrition is having children or young adults who are stunted, who are underweight, who are wasted. But that is the one that you can see now. In recent times, research has shown that when people are stunted as children, by the time they grow up, they are then predisposed to other non-communicable diseases. Talk about the diabetes, the hypertension, the obesity, and that eventually puts a lot of burden on Nigeria.
Because we are worried about the future of Nigeria, particularly in areas and regions where there's intense conflict and is conflict infested. People are not really feeding properly, and we don't want to end up with a generation that is completely stunted, their potentials are not realized, and they end up with all kinds of sicknesses, and they cannot contribute to productivity.
From this level, we gather other leaders and transfer to them the knowledge we have obtained from here, and then they transfer to other people till it goes down to the grassroots level.
The center said it will continue to leverage on the influence of faith leaders in the country in driving nutritional changes in Nigeria. In Abuja for News Central, I am Emmanuel. Bagudu.